Dear students, welcome back. The other joints present in the thorax are the intervertebral joints. That means the joints present in between the two vertebrae. In between the two vertebrae are called as intervertebral joints. Inter means in between, vertebra means two vertebrae, and the joint existing between the two adjacent vertebrae are called as intervertebral joints. Okay, so there is a median joint. So these are having this intervertebral joints between the two adjacent vertebrae is having three joints. So now we'll see what are those three joints. So this is the lateral view, and this one here at the middle, from body to body, it is going to attach. That is called as the median joint. Median joint between two vertebral bodies. Between two vertebral bodies, and right and left. So we are having two articular surfaces here, isn't it? A right and left articular processes are going to join with the inferior or a superior articulating surfaces, forming facet joints. So for example, this is the lower one. This lower vertebra is having superior articulating facets, is articulating with the inferior articulating facets, forming a facet joint. The same thing is also happening with the above vertebrae. Okay, these are called as facet joints. So such kind of joints are present on both the side, right side and left side. That means totally three joints. One median joint and two articular facet joints. So these three joints forms the intervertebral joints. So the joints between the articular processes, are plain synovial joints. Whereas the joint between the two vertebral bodies is a symphysis type of joint, that is the secondary cartilaginous type of joint. The surfaces of the vertebral bodies, is covered with hyaline cartilage. So the surfaces of the bodies are covered with hyaline cartilages, thin layers of hyaline cartilage. Between these two layers, a thick plate is present. A thick plate which is made up of with fibrocartilage. This is the thick plate which is made up of with the fibrocartilage, which is called as intervertebral disc. This intervertebral disc is present in between the two vertebral bodies, and this is also having an attachment with the superior as well as the inferior vertebral bodies. So now we will see the structure of the intervertebral disc. This is very important. So the intervertebral discs are the fibrocartilaginous discs which are present between the bodies of adjacent vertebrae, and this one also bind them together. Okay, and their shape corresponds to that of the vertebral bodies between which they are placed. That means, so the shape of the disc varies from cervical to lumbar. So according to the cervical region shape of the body, the disc is also present regarding to that region of vertebrae. If in the thoracic type, so it is somewhat heart shape. The body is in heart shape, so the disc is also the same type. In the if you take the lumbar, so it is almost all kidney shape or a big kidney shaped bone body is there. So such kind of shape of that body is occurring in that region. Okay, so and also this disc forms 1/5 of the length of the vertebral column. 1/5 of the length of the vertebral column. Okay, and the height of this intervertebral disc is greater in cervical and lumbar regions than in thoracic region, and each disc is made up of with some of the each disc consists of, we can say, consists of a central part and the peripheral part. The central part is called as nucleus pulposus, whereas the peripheral part is called as annulus fibrosus. The central part is soft and gelatinous at birth. Always it is kept under tension, and it acts as a shock absorber, hydraulic shock absorber. And with the age advancing, this elasticity of the disc is reduced. Okay, normally this is rich in water content. Okay, and now coming to the annulus fibrosus, this forms the peripheral part of the disc, and it is made up of an outer zone of collagenous tissue, collagenous fibers. That one is the narrow zone, that is the outer layer, and a wider inner zone. So in this also you can see two colors here. This is the outer zone is made up of with narrow zone, and it is made up of with collagen fibers. And the wider inner zone is made up of fibrocartilage. The fibers in these fibers form laminae that are arranged in the form of incomplete rings. So these are arranged like this. So some fibers are arranged like this and some fibers are arranged like this. So normally it is making some 120 degrees of angle. So no complete rings are present in this intervertebral disc, and these rings are connected by strong fibrous bands. Okay, the outer collagenous fibers blends with, that means this outer collagenous fibers attaches with the, here you will have the anterior longitudinal ligament and posterior longitudinal ligament is present. So these fibers are attached, that means joined with the anterior and posterior longitudinal ligaments. This is about the annulus fibrosus. So normally the disc is composed of two parts: centrally placed nucleus pulposus and peripheral annulus fibrosus. This central nucleus pulposus is soft and gelatinous at birth, and it acts as an hydraulic shock absorber, and during advancing of age the elasticity of the disc is reduced, whereas the annulus fibrosus consists of two zones, outer zone and the inner zone. Outer zone is a narrow zone which is made up of with collagenous fibers, and inner zone is called as wider inner zone, and it is made up of with fibrocartilage, and the laminae which are formed that are arranged in the form of incomplete rings, and these incomplete rings are connected with strong fibrous bands. Okay, and these outer collagenous fibers are attached with the anterior longitudinal ligament and the posterior longitudinal ligaments of the vertebral column. So the main function of this disc is it gives shape to the vertebral column. It acts as a shock absorbers. Because of their elasticity, they allow slight movement of the vertebral bodies on each other. Okay, and these movements are more in cervical and lumbar regions because the height of the discs are more when compared to the other regions. Okay, this is about the intervertebral disc. And the ligaments which are present in the vertebral joints are, so it consists of anterior longitudinal ligaments. So it is present on the anterior aspect of the intervertebral joints. So these anterior longitudinal ligaments passes from the anterior surface of the body of one vertebrae to the other. So it extends from the lower part, from the sacrum to the occipital. So the basilar part of the occipital bone, neck occipital bone వరకు లోయర్ అయితే sacrum వరకు extend అవుతుంది. Now coming to the posterior longitudinal. So this ligament not only present on the anterior, it occupies some lateral aspect, anterolateral part of the intervertebral joints. Now coming to the posterior longitudinal ligament, it is present on the posterior aspect. So this is present, the posterior longitudinal ligament is present on the posterior surface of the vertebral bodies, on the posterior surface of the vertebral bodies. So it is present on the posterior aspect of the vertebral bodies. So this is present within the vertebral canal. Okay, its upper end reaches to the axis vertebrae, that means second vertebrae, and also it is extended as membranotectoria. So this ligament extends at the cervical region as membranotectoria, that we are going to see when we deal with head and neck. Okay, so that is the posterior longitudinal ligament, and also it is continued low at the lower side up to the sacrum. Okay, now this is the anterior longitudinal ligament, and posterior longitudinal ligament supports the intervertebral joints. The other ligaments are intertransverse ligaments. Intertransverse ligaments means, for example, this is the transverse process, from transverse process to transverse process. So another ligaments are present, so that ligaments are called intertransverse ligaments. So these ligaments connect with adjacent transverse spinous ligaments, interspinous ligament, from spine to spine. So this is called interspinous ligaments. These are all short ligaments, intertransverse ligaments. So it is present in between the two adjacent vertebrae. Whereas this anterior longitudinal and posterior longitudinal ligaments are the continuous ligaments. So these are the partial ligaments present in between the two adjacent vertebrae. When another ligament is called as supraspinous ligament. So all the vertebrae is having spine, isn't it? So each vertebrae will have spinous process. All spinous processes are attached from above, from occipital to the sacrum. So this is called as supraspinous ligament. So this connects the tips of the spines of the vertebrae from 7th cervical to the sacrum. From 7th cervical, it is attached to the occipital bone, that is the skull. After that, this ligament name has been changed as ligamentum nuchae. Okay, from above 7th cervical spine. Next one is the ligamentum flavum. So this ligamentum flavum connects the laminae. You know this laminae, isn't it? So that means two pedicles are connected to form a laminae. These two laminae are connected. This is also made up of mainly the adjacent, mainly the elastic tissue. So the here you will have this ligament flavum, ligamentum flavum is attached from one laminae to other laminae. It is present here. It forms this ligament forms the present on the posterior aspect of the vertebral canal. Okay, these are the ligaments which supports the intervertebral joints, and the movements taking place in the intervertebral joints are flexion, extension, lateral flexion, and some amount of rotation is taking place. So in the case of thoracic region, flexion and extension are limited. Rotation is free in the thoracic region, and it is restricted in lumbar and cervical regions. This is about the intervertebral joints. So intervertebral joints are three in number. One is the median joint, which is formed between the two vertebral bodies, and the remaining two forms with the articular processes forms the intervertebral joints. In between the two intervertebral joints, a disc is present called as intervertebral disc. This disc is also attaches with the surfaces of the bodies of the two adjacent vertebrae, and these joints are supported by the ligaments. One is the anterior longitudinal ligament, posterior longitudinal ligament. So anterior longitudinal ligament, posterior longitudinal ligament, and intertransverse ligament, supraspinal, interspinous ligaments, and supraspinous ligaments. And then another ligament is the ligamentum flavum. So all these ligaments supports the intervertebral joints. So these are all about the joints present in the thoracic cage. Okay. So in the next session we are going to see the wall of the thorax, how the wall of the thorax is formed. Thank you.